Section 1: Understanding the chronic disease of obesity. Obesity is increasingly recognized as a chronic, relapsing, and multifactorial disease that poses significant challenges to public health worldwide. It is not merely a condition of excess weight, rather, it involves complex interactions between genetic, behavioral, and environmental factors that result in excessive body fat accumulation, leading to adverse health consequences. The understanding of obesity as a chronic disease is crucial for developing effective prevention and treatment strategies. Definition and epidemiology. Obesity is defined as a chronic, relapsing, and treatable disease characterized by excessive fat accumulation that negatively impacts health. This condition is not just about excess body weight, it involves an imbalance between energy intake and expenditure, influenced by a variety of factors including genetics, behavior, and the environment. Obesity is often quantified using the body mass index, BMI, a calculation based on an individual's weight and height. According to the World Health Organization, WHO, a BMI of 30 kilograms per square meter or higher is classified as obese. However, BMI does not distinguish between muscle and fat mass, so it is often supplemented with other measures, such as waist circumference and body fat percentage, to assess health risk more accurately. The prevalence of obesity has been rising steadily over the past few decades, with nearly one-third of the world's population now classified as overweight or obese. This increase is not limited to developed countries. Obesity rates are climbing even in low- and middle-income countries, reflecting a global shift towards more calorie-dense diets and sedentary lifestyles. The epidemiology of obesity reveals significant disparities across different demographic groups, with higher rates observed in certain ethnic groups, socioeconomic strata, and regions. Pathophysiology of obesity. The pathophysiology of obesity involves complex interactions between genetic, environmental, and neurobehavioral factors. Central to this is the dysregulation of energy homeostasis, where the body's natural mechanisms for balancing energy intake and expenditure become disrupted. The hypothalamus plays a crucial role in this regulation by integrating signals from various hormones, such as leptin, ghrelin, and insulin, which influence hunger, satiety, and energy storage. Leptin, produced by adipose tissue, is a key hormone that signals the brain to reduce appetite and increase energy expenditure. However, in obesity, a condition known as leptin resistance occurs, where the brain no longer responds effectively to leptin signals, leading to persistent hunger and reduced energy expenditure. Ghrelin, known as the hunger hormone, is secreted primarily by the stomach and stimulates appetite. Ghrelin levels typically increase during fasting and decrease after meals, but in individuals with obesity, this hormone may be dysregulated, contributing to overeating. Insulin, another crucial hormone, regulates blood glucose levels and fat storage. Insulin resistance, a hallmark of obesity, occurs when cells in the body become less responsive to insulin, leading to higher levels of insulin in the blood, increased fat storage, and eventually type 2 diabetes. The accumulation of visceral fat, the fat stored around internal organs, is particularly problematic as it secretes pro-inflammatory cytokines that contribute to chronic inflammation, further exacerbating insulin resistance and other metabolic disturbances. Complications associated with obesity. Obesity is associated with a wide range of comorbidities that affect nearly every organ system in the body. Cardiovascular diseases, including hypertension, coronary artery disease, and stroke, are among the most significant health risks associated with obesity. Excess body fat contributes to increased blood pressure, cholesterol levels, and the formation of atherosclerotic plaques, all of which elevate the risk of heart disease and stroke. Type 2 diabetes is another major complication of obesity. The chronic inflammation and insulin resistance associated with obesity lead to impaired glucose metabolism, resulting in elevated blood sugar levels. Over time, this can damage blood vessels, nerves, and organs, leading to complications such as retinopathy, nephropathy, and neuropathy. Obesity also increases the risk of various cancers, including breast, colon, endometrial, and prostate cancers. The exact mechanisms are still being studied, but it is believed that chronic inflammation, insulin resistance, and altered hormone levels associated with obesity may promote cancer development and progression. Respiratory complications are also common in individuals with obesity. Obstructive sleep apnea, OSA, is a condition characterized by repeated episodes of airway obstruction during sleep, leading to disrupted sleep and decreased oxygen levels. OSA is highly prevalent in individuals with obesity due to the excess fat around the neck and upper airway, which contributes to airway collapse. Other complications of obesity include osteoarthritis, due to the increased mechanical load on joints, particularly the knees and hips, non-alcoholic fatty liver disease, NAFLD, which can progress to cirrhosis and liver failure, and mental health disorders, such as depression and anxiety, which are often exacerbated by the stigma and discrimination associated with obesity. Obesity bias and stigma. Obesity bias and stigma are significant barriers to effective obesity treatment. Bias against individuals with obesity is pervasive, extending across healthcare providers, workplaces, and society at large. This bias can lead to discrimination, lower self-esteem, and avoidance of healthcare, further exacerbating the health problems associated with obesity. Healthcare providers, in particular, may hold negative attitudes towards patients with obesity, viewing them as non-compliant or lacking self-control. These biases can impact the quality of care provided and discourage patients from seeking necessary medical attention. Healthcare providers must approach obesity as a chronic disease, focusing on empathy and support rather than judgment. Diagnosing and assessing obesity. Accurate diagnosis and assessment are essential for effective obesity management. While BMI is the most commonly used measure, it should be complemented by other assessments, such as waist circumference, body composition analysis, and the evaluation of obesity-related comorbidities. Waist circumference is particularly important as it provides an estimate of visceral fat, which is more strongly associated with metabolic risk than overall body fat. In addition to physical measures, a comprehensive obesity assessment should include a thorough medical history, including weight history, dietary habits, physical activity levels, and psychosocial factors. Understanding the patient's motivations, challenges, and readiness for change is also critical in developing an individualized treatment plan. Treatment approaches. The treatment of obesity requires a multifaceted approach that includes lifestyle interventions, pharmacotherapy, and, in some cases, bariatric surgery. Lifestyle interventions, including diet and physical activity, are the cornerstone of obesity treatment. The goal is to create a sustainable calorie deficit while promoting healthy eating patterns and regular physical activity. Behavioral therapy is also an essential component of obesity treatment, helping patients identify and change unhealthy behaviors related to eating and physical activity. Cognitive behavioral therapy, CBT, and motivational interviewing are commonly used techniques that have been shown to be effective in supporting weight loss and maintenance. Pharmacotherapy may be indicated for individuals who do not achieve sufficient weight loss with lifestyle interventions alone. Several medications are approved for the treatment of obesity, each with different mechanisms of action, such as appetite suppression, fat absorption inhibition, and increased energy expenditure. Bariatric surgery is the most effective treatment for severe obesity and obesity-related comorbidities. Procedures such as gastric bypass, sleeve gastrectomy, and adjustable gastric banding result in significant weight loss and improvements in metabolic health. However, surgery is not without risks, and long-term follow-up is essential to monitor for nutritional deficiencies and other potential complications.